Hello, I'm Dr. Bryan Haas. For many years now, I've specialized in spinal rejuvenation therapy and brain-based therapy. I've studied under one of the country's leading chiropractic neurologists, Dr. Michael Johnson. Dr. Johnson's brain-based therapy that we use in our office has helped thousands of fibromyalgia patients across the entire country. Today I'd like to speak with you about fibromyalgia. Fibromyalgia basically means that you have pain all over your body and you're chronically fatigued. Okay? My patients would describe it as having the flu 24/7, day in and day out, throughout the entire year. It can be so bad that patients have trouble putting one foot in front of the other. Maybe this has happened to you. Patients that suffer from fibromyalgia, you know what? They can't sleep at night, and they struggle just to get through the day without taking tons of medications, a whole laundry list of medications. They're in constant pain, and they're extremely fatigued. They may not even be able to continue working. Some can't even hold a full-time job. You see, the challenge with fibromyalgia is that there is no lab test. There's no blood work. There's no imaging studies, no CTs, no MRIs to diagnose fibromyalgia. Most fibromyalgia patients are diagnosed by a rheumatologist. A rheumatologist is a doctor that specializes in arthritis. And with this, there's supposed to be 11 of 18 treating trigger points that are tender. Sometimes there's 9, sometimes there's 15. You know what? It really doesn't matter. It does become an issue when a doctor thinks that the patient is faking it or it's all in their head. You know what? Sometimes the doctor will tell the patient that just go out and exercise, you know, and this is something that they'll have to live with. Well, I'm sorry, you know, this is absolutely not true. It's not true. You see, in our office, we help patients get better with fibromyalgia. We help fibromyalgia patients get better. And there's two major facts I want to talk to you about fibromyalgia. Number one is fibromyalgia is not a muscle problem. Okay, folks? I want to say this again. Fibromyalgia is not a muscle problem. I know that this has probably confused some of you that suffer from fibromyalgia because patients tell me all the time, Dr. Haas, you know what? It feels like a muscle pain. It feels like a muscle problem. I got neck pain, neck stiffness. My neck is bothering me. My shoulder is bothering me. I have shoulder pain and stiffness. Or they'll say my lower back. Even my lower back is stiff. It's painful. The muscles that are hurting, folks, are nothing more than a symptom of an underlying cause. We will get to in a few minutes. So if treating the muscle pain were to fix your problem, you would not have fibromyalgia anymore. So there has to be, folks, there has to be an underlying cause. And that leads to my second point, is that the latest scientific research states about fibromyalgia and chronic pain is that fibromyalgia is a neurogenic condition, folks. It's a neurogenic condition. What this means is that it's a brain-based condition, and the pain is generated in your brain, okay? Let me explain as simply as I can what the cause of fibromyalgia is, okay? The cause is coming from the upper brainstem, right into this area of the brain, right in through here. The upper brainstem, there's 3 parts to the brainstem. You have the top, middle, and the lower. The top is called the mesencephalon. The middle is the pons, the lower is the medulla. Okay? Thank you.